Imagine walking into your medicine cabinet right now and discovering that one of the pills you take daily could be slowly stealing your memory, increasing your risk of dangerous falls, and potentially shortening your life. What if I told you that millions of seniors are unknowingly taking medications that medical experts now consider more harmful than helpful? Today, we're going to expose a shocking truth that the pharmaceutical industry doesn't want you to know about a class of medications sitting in medicine cabinets across America. My name is Dr. Sarah Chen, and for the past 15 years, I've specialized in geriatric medicine. What I'm about to share with you today has kept me awake at night, because I've seen too many patients suffer needlessly from medications that were supposed to help them. This isn't about fear-mongering or conspiracy theories. This is about cold, hard medical facts that could save your life or the life of someone you love. The pill I'm talking about isn't some obscure medication you've never heard of. It's a class of drugs that's been prescribed to seniors for decades, often without doctors fully explaining the serious risks involved. These medications are called anticholinergics, and they include common drugs like Benadryl, certain sleep aids, muscle relaxants, and even some antidepressants that many seniors take without question. Let me paint you a picture of what happened to Margaret, a vibrant 73-year-old woman who came to see me last year. Margaret had been taking a combination of medications for allergies, sleep problems, and mild depression. She was sharp as a tack, ran her own small business, and had never had any serious health issues. But over the course of 6 months, her family noticed she was becoming increasingly confused, falling more frequently, and struggling to remember simple things like where she put her keys or whether she'd taken her medication. Her previous doctor had dismissed these symptoms as normal aging, but I suspected something else was going on. When I reviewed her medication list, I found she was taking 3 different anticholinergic medications simultaneously. Within 2 months of carefully reducing these medications under medical supervision, Margaret's cognitive function improved dramatically, her falls stopped, and she regained her independence. The transformation was nothing short of remarkable. But Margaret's story isn't unique. It's happening to thousands of seniors every single day, and most don't even realize their medications could be the culprit. Here's what makes this situation so dangerous. Anticholinergic medications work by blocking acetylcholine, a crucial brain chemical responsible for memory, learning, and muscle function. When you block this chemical, especially as we age, the consequences can be devastating. The research on this topic is absolutely staggering. A groundbreaking study published in a major medical journal followed over 3,000 seniors for 7 years. The results were shocking. Those taking high levels of anticholinergic medications had a 54% increased risk of developing dementia. Let me repeat that. 54%. We're not talking about a small statistical blip here. We're talking about a massive increase in one of the most feared conditions of aging. But dementia isn't the only concern. These medications also significantly increase the risk of falls, which might not sound serious until you realize that falls are the leading cause of injury-related death in people over 65. When anticholinergic drugs impair balance, coordination, and cognitive function, they create a perfect storm for dangerous accidents. The cardiovascular effects are equally alarming. These medications can cause irregular heart rhythms, dangerously low blood pressure when standing up, and increased risk of stroke. For seniors who already have heart conditions, adding anticholinergic medications can be like playing Russian roulette with their health. Now, you might be wondering why these medications are still being prescribed if they're so dangerous. The answer is both simple and infuriating. Many doctors aren't fully aware of these risks, and the pharmaceutical industry has been slow to acknowledge the serious long-term consequences. Additionally, these medications often provide short-term relief for common problems like insomnia, allergies, or mild depression, making it easy to overlook the long-term dangers. The most commonly prescribed anticholinergic medications include diphenhydramine, which you probably know as Benadryl, often used as a sleep aid in seniors. There's also hydroxyzine for anxiety, certain tricyclic antidepressants like amitriptyline, muscle relaxants such as cyclobenzaprine, and even some medications for overactive bladder. Many seniors are taking multiple medications from this list without realizing they're compounding the risks. What makes this situation even more tragic is that for most conditions these medications treat, there are safer alternatives available. For sleep problems, instead of reaching for Benadryl or other anticholinergic sleep aids, seniors can benefit from melatonin, better sleep hygiene practices, or addressing underlying conditions that might be causing insomnia. For allergies, newer antihistamines like loratadine or cetirizine don't cross the blood-brain barrier and are much safer for older adults. Depression and anxiety, which are common reasons for prescribing anticholinergic medications, can often be better managed with newer antidepressants that don't have these dangerous side effects, or with non-medication approaches like cognitive behavioral therapy, regular exercise, and social engagement programs specifically designed for seniors. The key is working with a healthcare provider who understands geriatric medicine and takes the time to review all medications regularly. This process is called deprescribing, and it's becoming increasingly recognized as a crucial aspect of senior health care. Deprescribing doesn't mean stopping all medications cold turkey. That can be dangerous too. Instead, it's a careful, systematic approach to reducing or eliminating medications that may be causing more harm than good. If you're a senior currently taking any of these medications, or if you have a loved one who is, don't panic. The most important thing is not to stop any medications suddenly without medical supervision. Abruptly stopping certain medications can cause withdrawal symptoms or rebound effects that could be dangerous. Instead, schedule an appointment with your doctor specifically to review all your medications. During this appointment, come prepared with questions. Ask about each medication. What is this for? Is it still necessary? Are there safer alternatives? What are the long-term risks? How does this interact with my other medications? A good doctor will welcome these questions and work with you to optimize your medication regimen. One of the most powerful tools you can use is called the Beers criteria, a list of potentially inappropriate medications for older adults that's updated regularly by geriatric medicine experts. Many of the anticholinergic medications I've mentioned are on this list, yet they continue to be prescribed routinely to seniors. The anticholinergic burden can be measured using various scales that help quantify exactly how much risk you're facing from your current medication regimen. These tools assign scores to different medications based on their anticholinergic activity, and the higher your total score, the greater your risk of cognitive decline, falls, and other serious side effects. But here's what gives me hope: when these dangerous medications are carefully reduced or eliminated, the improvements can be dramatic and relatively quick. I've seen patients regain their mental sharpness, stop falling, sleep better naturally, and rediscover their zest for life, all by addressing their medication regimen. Let me share another success story. Robert, an 80-year-old retired teacher, came to me because his wife was concerned about his increasing confusion and several recent falls. He was taking a cocktail of medications including an anticholinergic antidepressant, a muscle relaxant, and using Benadryl regularly for sleep. His anticholinergic burden score was dangerously high. We developed a careful plan to transition him to safer alternatives over several months. We switched his antidepressant to one without anticholinergic effects, replaced his muscle relaxant with physical therapy and gentle exercises, and addressed his sleep issues with better sleep hygiene and a small dose of melatonin. 6 months later, Robert was back to reading complex novels, had stopped falling entirely, and was sleeping better than he had in years. The transformation wasn't just physical, it was emotional too. Robert's family got their husband, and farther back, his grandchildren could have meaningful conversations with him again. He regained his independence and confidence. This is the kind of outcome that's possible when we take medication safety seriously. Prevention is always better than treatment, so if you're not yet taking these medications, be extremely cautious about starting them. When a doctor suggests an anticholinergic medication, ask specifically about safer alternatives. For sleep issues, explore sleep hygiene, relaxation techniques, or safer sleep aids. For allergies, consider non-sedating antihistamines or nasal sprays. For depression or anxiety, discuss newer medications with better safety profiles or non-medication approaches. Family members and caregivers play a crucial role in this process too. If you notice a loved one becoming more confused, falling more frequently, or seeming less like themselves after starting new medications, don't hesitate to advocate for a medication review. Sometimes family members are the first to notice these subtle but important changes. The healthcare system needs to change too. We need better education for healthcare providers about geriatric pharmacology, more time for medication reviews during appointments, and better coordination between different specialists, who might all be prescribing medications without fully understanding the cumulative effects. Insurance companies also need to recognize the value of comprehensive medication reviews and the specialized care that geriatric medicine provides. The money spent on preventing medication-related problems is far less than the cost of treating falls, hospitalizations, and dementia that can result from inappropriate prescribing. Technology is starting to help too. There are now computer systems that can flag potentially dangerous medication combinations and alert doctors to high anticholinergic burden scores. Pharmacists are also becoming more involved in medication safety, and many offer comprehensive medication reviews that can identify potentially problematic combinations. But ultimately, the most important factor in your medication safety is you. Being an informed, engaged patient or caregiver makes all the difference. Keep detailed records of all medications, including over-the-counter drugs and supplements. Know why you're retaking each medication and don't be afraid to question whether it is still necessary. Regular medication reviews should be part of routine health care for all seniors, ideally every 6 months or whenever there's a change in health status. This isn't just about anticholinergic medications, it is about ensuring that every medication you're retaking is still appropriate, necessary, and safe given your current health status. The message I want you to take away from today is and to fear all medications, many are genuinely life-saving and necessary. The message is to be informed, be proactive, and never assume that just because something is prescribed, it's automatically safe for long-term use, especially as we age. Your brain, your independence, and your quality of life are too precious to risk on medications that may be doing more harm than good. Take control of your medication safety today. Schedule that appointment, ask those hard questions, and don't settle for answers like, "That is just part of getting older," when there might be a medication-related cause for your symptoms. Remember Margaret and Robert? Their stories could be your story too. The power to protect yourself and your loved ones from these dangerous medications is in your hands. Use it wisely, and don't let another day go by wondering if the pills in your medicine cabinet are helping or harming you. If this video has opened your eyes to the hidden dangers lurking in medicine cabinets across America, please share it with every senior you know. Knowledge is power, and together we can protect our most vulnerable population from these preventable medication-related harms. Your sharing could literally save someone's life, memory, and independence.